8:48, welcome back to the Morning Drill, a Wednesday morning. And if you didn't know, May is Stroke Awareness Month. And joining us this morning, representative of the Titusville Area Hospital. Doc, introduce yourself, would you please?
Yes. Hi, Luke. Thanks for having me here. My name is Cristian Popescu. I'm an internal medicine physician here in Titusville. I am working with 3 other physicians in a local practice, Oil Valley Internal Medicine Associates. And I wanted to say thank you to our hospital administrator, Lee Clinton, for inviting me here today. And thank you for having me here as well.
Well, listen, you're a great guy. You're involved with the community. Everybody knows you, and it's got to be a little awkward when somebody comes up to you at the grocery store and says, "Hey, Doc, take a look at this." What's wrong? Because you know that happens. Is that the charm of small town life here?
Yeah, it happens more than I would like to admit, and I have absolutely no problem doing that anymore. It kind of grew onto me, and yeah, it is definitely is part of it, and feeling useful even when you go to get some groceries at the store. I think, it doesn't bother me at all. I think it's definitely a plus for living here. I treat everybody like they my family, and I feel if I can be useful, even when I'm in the grocery aisle and trying to buy some potatoes, that's fine. Works for me anytime.
Well, I know I've walked past you and you've had conversations with other people, and it's not always them reaching out to you. You just, because of who you are, will say to them, "Hey, how you doing? Is everything okay?" And you check up on them, which is great. We mentioned May is Stroke Awareness Month, and people think, when wintertime hits and people are out shoveling, you think, "Oh no, this is the time when people are going to have a heart attack." But the weather's changed. It's warm. People are going outside, and they might not be warming themselves up. They're going out and playing softball or going out and playing basketball. It's a good time to remind people, what happens with stroke and heart attack. So I guess we'll just get right into it. What is a stroke? How do you get one?
That's a good question, and I want to say a word about how important education is in health care, and how being more educated sometimes you can save your own life or help save somebody else's life. So I want to say that I'm really glad that I have a chance to do this here today. But going back to what is a stroke, a lot of people don't understand exactly what that means. In simple terms, I would compare it to a heart attack, but a heart attack of the brain. A part of the brain stops getting blood, and it eventually dies, or it just gets stunned sometimes, and that results in symptoms that become visible on a patient or on us. And it's very important to recognize those symptoms. I assume that you are going to follow up with probably
just go right into
question.
it. Yeah,
okay.
Sure.
So some symptoms of stroke are definitely related to our muscular and the locomotion system, as we call, and it has to do with we're unable to move our arms or legs. It's usually unilateral. That means on one side of the body. Of course, if it's on both sides, it is much more complex and difficult. But it usually starts with an arm that we're unable to move, or we move it, but it's clumsy. It doesn't move right. Some patients complain of sensation being abnormal and not feeling things right. Like, for example, if you hold a cold water bottle in your hand and you don't feel it's cold, that can be a symptom of a stroke. Also being unable to walk. The speech can be affected. Vision, sometimes you can see double or you cannot see at all out of the eye. And that is a very common symptom of stroke that not many people understand, that it's important to get to the hospital fast when you have something like that affecting your vision. But not being able to see out of one eye can actually be a stroke, and it's very commonly such a thing, and that needs to be treated right away.
So, could this affect anyone, or I mean, what are some of the factors for stroke risk?
Well, stroke can affect anybody pretty much. However, it has certain groups that will be more affected by this, and it's usually males who are over 50. But as I said, it does not always make a difference. Some of the risk factors that are associated with this are the same risk factors that cause heart attacks. And I think we all know high blood pressure and why it is important to be treated. Elevated cholesterol is another risk factor that's very important to be controlled in this setting. Diabetes is a major risk factor for strokes, and that's why it is important to have regular glucose checks in the office and see a doctor for that. Atrial fibrillation is a fancy name for irregular heartbeat, and what that means, it's exactly what it said. You know, the heart does not beat regularly as it should. Now, only a doctor can usually diagnose this, so just having an irregular heartbeat does not necessarily mean that you have atrial fibrillation. It has to be done via a specialized test called an EKG or electrocardiogram. But atrial fibrillation is one of the biggest risk factors for stroke, and everybody who has atrial fibrillation has to be evaluated for possibly needing what we call anticoagulation therapy or blood thinners. Other risk factors are, of course, being overweight that can affect possibility of stroke. You can get a stroke from being overweight, and diet and exercise are also very important factors that can actually mitigate and improve your odds of not having a stroke.
I'm just going to ask you a question. Are there things that are similar to strokes that maybe mimic them as far as symptoms go? I'm thinking of things like Bell's palsy or Horton syndrome or something like that, or is that totally different territory?
Well, you do have a good point there. Absolutely. Bell's palsy is the greatest mimic of stroke, and sometimes even physicians have a hard time making a difference. But you know, with tests, we can actually tell whether it's one thing or another. However, we encourage patients to always err on the side of the stroke and assume that it may be a stroke until a physician decides that that's probably not a stroke. Why? And I think I'm jumping ahead here a little bit, but I think it's worth it. Treatment of stroke is very time dependent, and you only have about 3 hours to get a medicine that is actually a clot buster, and with that medicine you can actually have complete reversal of your symptoms. So that's why
wow. Within 3 hours.
Yes, it is so important to recognize stroke immediately and get the proper care in the proper setting.
Well, how many times does somebody say, or maybe have those symptoms and think, oh, I'm just not feeling well, I'm going to go take a nap or I'm going to go sleep, and then they blow past that 3 hour window?
It's extremely frequent.
Wow.
Look, I can think at least of 2 patients right now that within the last 6 months told me that they went to sleep hoping that it will go away. And it's just not the right thing to do. Why? Because if you try that and the symptoms don't go away, then you will be left with a deficit for life. You may not be able to move your arm, you may be in a wheelchair, you may have to use a cane. or crutches or a walker for the rest of your life, and that is definitely a problem.
Are men more stubborn to go to the doctor and get checked than, say, maybe a female going through those symptoms?
I don't think so. Look, I think we're equally stubborn here.
Okay,
if you can
so
put it that way.
so women think the same way then. That I'll just wait it out. It should go away.
Yes. I think I'm not sure I get the question here though.
Well, I'm just wondering. You'll hear guys say, "Oh, I'll just sleep it off," or "I'll it's not a big deal. It'll go away eventually." But that's the wrong attitude to have. If they're starting to feel any of these symptoms, they need to get up to the hospital immediately.
Exactly. And for some unknown reason, actually a lot of people have this instinct that they just want to go back to sleep. My belief is that fatigue is part of the symptoms of stroke. You feel very tired. You just don't feel right, and sometimes that in itself can be a symptom of stroke before arm or leg weakness or other symptoms come. You may just feel odd, and sometimes you can have a headache instead of an arm deficit, and that the arm deficit will follow later. So I believe that, what do you do when you're tired? You want to get some rest, so you think it's just you didn't sleep right or you're just tired, so you go to bed. But that you're definitely right. That's the wrong thing to do.
Some people have heard of FAST, the FAST, the acronym. What's that stand for?
Well, the first thing that you want to think and why it's called a FAST acronym is because you want to act fast, and I think that's very important in a stroke setting. As I said, you got 3 hours to get to the hospital and get the clot buster. So that includes a CAT scan, blood work. So there's a lot of things that you need to have done in 3 hours. So needless to say, if you get there 2.5 hours, it may actually not be enough time to get a clot buster. However, we can extend that time to 4.5 hours for special circumstances, but 3 hours is the time that I want everybody to remember. So going back to the FAST acronym, it's an easy way to remember what stroke means and what the symptoms of stroke involve. And FAST stands for, the F stands for face. It's hard to see somebody who has a stroke and has a face droop. That's a pretty big symptom of stroke. So what we usually do as physicians, we ask the patients to show our teeth or blow their cheeks out, and you can tell that there's an asymmetry involving the face. The face that's affected by the side of the face that's affected by the stroke is abnormal. It just doesn't follow through. It's usually sagging. So that's how you can tell there's a problem. The A in the FAST acronym stands for arm, and it can be an arm or a leg, but arm is much more commonly involved. That's why we put more emphasis on the arm. It can be clumsy, it does not move right, it can be stiff. You can hold even a glass of water in it. There can be sensory abnormalities, but mostly we refer to arm weakness. That is the biggest symptom there. S in the FAST acronym means speech. The speech is often affected. Usually what we recommend, ask the patient a simple question or the person you're dealing with and observe their speech carefully. If you do not feel that their speech is normal, like their usual speech, or they garble their words, or they can't say a proper word that they used to say, anything that doesn't seem right can actually signify that the patient is having a stroke.
Do they know they're not saying it right, or do they think they're saying it right and it's not coming out right?
Patients are never aware of the symptoms. That is a very interesting fact of stroke. So if you try to diagnose yourself, you're probably not going to be successful. You can say a complete wrong sentence and you will not be able to tell that you actually didn't say it right.
Wow.
That's why it's very important to have somebody else doing this. And if you think you're having a stroke, then and there's nobody around, then the speech is not one thing that you want to go by. You want to look by other things.
Okay.
Or if you don't feel right, then you wanna just seek medical care. So going back to the FAST acronym, the T in the FAST acronym stands for time, and it's exactly as I said before. You got 3 hours from the onset of symptoms. That usually means that if you wake up with symptoms of stroke, there is a chance that you may not be able to receive the clot buster, and you may have the deficits. You may have no treatment for those deficits, and that may be a problem. However, that still means that you need to go to the hospital or call 911 right away and make sure that you'll be getting the attention, the medical attention that's needed.
Doc, thank you so much for your time this morning. May is Stroke Awareness Month. If folks have any questions, they want to maybe get more information, what can they do? Can they reach the hospital?
Absolutely, and I suggest that you see a physician, your personal physician. If you don't have one, we suggest that you call the hospital number and get a new physician. But I suggest that the best thing to do is to talk to your doctor, as we can assess your risk factors, and we can tell you what to do to decrease the risk factors for stroke that will decrease the chance that you will actually have such a terrible disease.
All right. Doc, great to see you this morning. Mark,
Thank you.
What'd you learn today?
Well, I learned quite a bit about stroke. Having experienced a little bit of that myself, it's always good to get a little bit of insight into that. So happy to see you today.
Thank you.
Doc, what'd you learn?
What did I learn? Well, I learned to be on the camera, which is good.
You did a great job.
Thank you.
And thank you for joining us today. We'll be back tomorrow, 6 a.m. for Daybreak News, the morning drill from 7 to 9. Have a great Wednesday. Enjoy that weather. 84 degrees today. Oh, it's going to be nice. Get out and enjoy it.